Hi there, this is Melanie Didham, critical care educator with the Critical Care Nursing Program. I am just going to continue on with our series preparing our preceptors to work with our students. So, while giving and receiving feedback can be a delicate process, there's no doubting its value in improving performance and allowing the growth of a novice nurse, and also helps with experienced nurses as well. Providing feedback. Feedback is one of the most important activities in the preceptorship relationship. Being able to provide and receive feedback in an open, honest, non-threatening manner is a critical skill for both the preceptor and the preceptee. And what this means is you don't need to avoid negative or corrective feedback altogether. You just really want to make sure that when you give feedback, you want to follow up with a suggested solution or an outcome. And that gives you an achievable goal that someone can work on to improve said skill. So, goals of feedback is to encourage, enthuse, and improve performance, to sustain continued good performance, and to convey your feedback using a supportive language. So, what's the motivation for feedback? The motivation is to improve the situation or improve the person's performance or understanding or knowledge of a certain area. This is not accomplished by being harsh, critical, or offensive. As I've said, you need a supportive environment to have a good learning environment. Feedback. So I'm going to discuss 3 different ways of providing feedback and what your approach would be to provide said feedback. First, positive feedback. The best way to provide any kind of feedback is to have a civil and a safe environment, and this will give you a greater impact with better results in providing positive feedback or any feedback to anyone. And it could be to your preceptee, your coworker, family member, anyone at all. And usually positive feedback is good, and it's usually received well. And the person providing the feedback finds it very easy and can provide it, and usually don't feel very stressed about providing said feedback. And positive feedback, usually with your preceptee, it provides some feeling of success. It will increase their motivation for learning. It reinforces desired performances, and it enhances the learner's self-esteem and confidence. So if anything's delivered in a positive light, usually people are a lot or very much receptive to it. Negative feedback. So in certain situations, if you're being harsh, it can produce a feeling of failure in the preceptee. It limits or reduces motivation to learn, tends to focus on what not to do, and it can be discouraging and demoralizing, and also diminish the self-esteem and confidence of the novice nurse. If the person receiving the feedback isn't comfortable, this can cause the feedback to ultimately be unproductive. Anything that's mean-spirited or demeaning is not effective. It achieves defensiveness and not openness to change. So, next we have a combination of both positive and negative feedback. And that combination is determined to be constructive feedback. So with constructive feedback, the goal is to produce feelings of at least partial success in your novice nurse or preceptee. And by doing this, it should maintain their motivation for learning, and it should reinforce their desired performances, that they're doing well, and correct any unsatisfactory aspects of their performance, or help correct any gaps in knowledge or skills. And by doing it this way, the end goal is to maintain their self-esteem and help build with their confidence in their abilities. And by doing this, you're not tearing the person down or demoralizing them or, disregarding what they bring to the table already. And this will allow you to address anything that needs addressing, but it also provides a safe, supportive environment and have your preceptee in a receptive mode to these improvements or gaps or observations that you've made that could use some polishing, shall we say. So, some strategies for constructive feedback is first, usually we get the preceptee to do a self assessment on how they did on the positive side. So, doing a reflection of what you did well is powerful because it emphasizes the positive and it encourages self reflection. And usually, you can get this information by asking them what went well. And self-reflection is an amazing learning tool. It is also the best building block for critical thinking skills. And it allows the preceptor to better assess where any learning gaps are and to focus on that. And another thing you can do as a preceptor is then list what areas you observed that went well, and then lead into some more constructive feedback by asking the preceptee what they felt could have been improved, or is there anything that they could see that perhaps they would be better at a next time, or some kind of learning gap that they might have observed that they would want to work on. And then you could add anything that you think could be improved, that may be something that the person isn't even aware that there's a learning gap there. So this streamlining of the teachable moment is not a repeat. The goal is to not repeat what is already understood, which would risk losing the attention of your preceptee. So if you go through A, B, C, D, and E, and the learning gap is only at D and E, then by rehashing everything that they already know or understand, you've already lost your preceptee's attention, because they'll be like, oh, I know that. So by going through this little process, it can help streamline what you actually do as your teachable moment. So some guidelines is share your information, but don't advise. So you can say, would you like to hear about, the time that I almost lost a patient because of blah, blah, blah. And be specific. So if you're giving positive feedback or even negative feedback, or constructive feedback, be very specific. Don't just say, oh, your procedure sucked, or don't, that's never positive, or say, oh yes, your assessment skills are awesome. Be specific about what you observe that is good, bad, or indifferent. So saying you maintain sterile procedure during a particularly difficult intervention might be an awesome thing to do. Check in with your preceptee. Ask them, how do you feel that intubation went, for example, or how do you feel that whole procedure went? You can offer them some suggestions that are something that they can keep in mind rather than give them directive advice. So such thing as, have you ever thought of trying a different approach when, blah, blah, blah. Because there's always more than one way of doing something, unless it's outwards totally wrong, or outwards not safe or unsafe or totally not evidence-based, then in that case you would definitely give directive advice, or if it's totally against procedure. But if they go from head to toe in assessment and you go from toe to head, doesn't matter, but you might say, you might find it easier if we do this way first, okay? Don't give feedback when you're tired or emotionally charged. And that's pretty self-explanatory. Nobody is, going to discuss anything in a nice, logical fashion if they're tired or, angry or excited or sad or whatever. Limit your feedback to allow processing of information. So soon after the event or during a break, or, go for a walk or do something, but make sure that you just give your feedback after they've had a chance to decompress maybe. Be timely. So you don't want to wait until the end of your preceptorship to address some kind of an issue or a knowledge gap. You want it to be as close to the event as possible. So saying something like, now that we've finished doing this, this, or this, I would like to talk about blah, blah, blah. And whether it's good feedback or indifferent feedback, just make sure you do it in a more timely fashion. And one of the most important things in life, be respectful. So if everyone was just respectful of each other, this place would be a much, much better place to live. So being helpful and non-threatening in private will demonstrate respect, and it will definitely help improve the learning environment as well. Focus on behavior which can be changed, not personality traits. So for an example, when you speak in a moderate tone, I notice people grasp what you're saying. So, you're not telling someone you're very abrasive. You don't say something like that. You've lost them right at the get-go if you do something like that. So, definitely look at something that can be changed, not necessarily their personality. Or saying someone's too loud. Just say, yeah, when you talk in a lower voice, people really pay attention to you. Provide feedback in a confidential setting. So you can meet in the conference room, go out in the hallway, go in the break room, and that's for anything that's constructive feedback, okay? And one thing to remember is give praise in public, but any criticism should be done in private. So if any issues are identified or observed, solutions should be a part of the discussion. So you're not just identifying a problem between you and your preceptee. You should identify a way to solve this problem or some way to address it, because it's not constructive if there is not a solution or a plan in place afterwards. Here is an anagram on how to provide effective feedback. So the goal of feedback is to improve performance, with the I being identify the competency or skill that is good, bad, or indifferent. M, make a feedback-friendly environment. P, performance, assessment, and prioritize the feedback. So you balance your positive with your constructive. And don't just bombard someone with a whole slew of things. You get too much information overload. So try and dole it out on a priority basis if it comes down to being more than one thing. R would be respond to the learner's self-assessment. O would be objective, specific, descriptive, non-judgmental, sensitive to the other person's feelings. V would be validate what's been done well or suggest some alternative strategies. And E would be establish a plan for the new goals or improvements. So a good tip is to limit your focus. So as I addressed a little bit earlier, I said no more than 2 issues should be discussed at a time. Any more than that, and you risk the person feeling attacked and demoralized. So, feedback. When it's done in a right way, with the right intentions, feedback can lead to outstanding performance. And a key point to think is feedback is a two-way street. The ability to give and receive feedback is a skill that, with practice, is a positive, powerful means of personal development and positive change with yourself, your preceptees, and your colleague. And feedback is something I find gets missed quite a lot sometimes in our field because people aren't comfortable with giving feedback to people, especially if it's something that is looked at as negative or constructive. So this is just a few tips on how to address anything, as I said, good, bad, or indifferent in your preceptee, and you will be able to hopefully use some of these tips even in your everyday life, not just as a preceptor. And that's the end of this session.